Hi, this is Dr. Philip Cordova with Core Chiropractic. Today we're going to talk about leg length x-rays. So it's very important that we get the right measurement so we can determine if one of your legs is shorter than the other. Now, you may feel like this isn't very common, and that's what we used to think too, but what we've actually found is that as much as 90% of the population can have a leg length difference that's between 3 and 5 millimeters. Now, that's not a lot, but it's enough to want to do something about it to help you hold your adjustments in place. It makes up and helps you understand why you might have problems when you're running, why one hip, one knee, one ankle is all having issues, why when you go to the chiropractor, you can't seem to hold your adjustment very long. What we found is that most people have a difference of at least 3 to 5 millimeters, but a lot of people have a much bigger leg length difference. So in order to get the most accurate measurement, we take a leg length x-ray in our office. Now I'm going to show you how we do it, why it's so accurate, and we can get down to the millimeter as to which leg is longer or shorter than the other. Okay, so once we've actually done the leg length x-ray, there's a couple options here. So one, we could find that you do not have an anatomical leg length difference, and that means it's functional, which means it can be adjusted back to normal. Or we're gonna find that you have a minimal difference that does not require a leg length or a heel lift to be put in there. Or we may find that you need a small heel lift. Now, if it's greater than 10 millimeters, which is less common, you're gonna need a full shoe insert. In very rare cases do people end up like modifying their shoes, doing something different. Usually between like a heel lift or a full shoe insert, you're able to balance out, get the benefit you need, where literally have had patients where all their pain goes away once the lift is in and all their pain comes back when you take the lift out. The important thing is to find out exactly how far off you are so we can then make the right decisions about what's going to work best for you. It all starts with that initial evaluation, and if we think you need a leg length x-ray, then we're going to recommend that. Once we get that number, we can take the next steps.